Hi, everyone. Rochelle here, and Dr. Dana Philossaint, welcoming everyone back to another episode of MindCare. This series, we have been discussing dealing with childhood trauma and its effects. This podcast aims to provide hope and answers and take away the stigmas of childhood traumas. Dr. Dana Philossaint is a professional counselor whose focus is on childhood trauma. Hi, Dr. Dana.
Hi, we're back again. We've been getting a lot of feedback, by the way, on our previous sessions. So hopefully everyone is here today. We'll go back and listen to some of those, but we're excited to be here.
Yes, and today is a fantastic topic. And so the topic for today is 5 ways to become resilient and face your trauma victoriously. Discover if counseling is necessary. So Dr. Dana, the first question is, what does it mean to be resilient?
Good question. But before I tell you what the definition is, in life is so unpredictable, number one. People will seemingly go through trials and things that are adversely can impact them. But there are some individuals who seemingly just bounce back so quickly, and why is that? There are individuals who've gone through poverty from birth or prenatal stressors in life that could have brought them down, or have troubles in their family environment, or even they were at risk for many things, for health problems and learning problems and behavior problems. But yet those individuals grow up to be confident adults, right? And so this is what we call resilience. Resilience is showing to protect that individual against the trauma breakdown, and can even alleviate an individual's feelings of helplessness, even when they face pressure to feel down. And so resilient the definition is a dynamic process allowing for positive adaptation in a context of significant adversity. So it's their measure of stress coping ability, their ability to thrive in the face of adversity, or even to get to the point where it doesn't impact them in a way that research showed that it should have impacted them. But these individuals grow even more so positively to have a stable mental health, a stable physical health, and they maintain that equilibrium within themselves.
Now, I've heard that word before, thrive, for an individual to be able to thrive. So the question is, who is resilient and what makes them? What makes them thrive?
That's a good question, too. So it goes back to like 1971. There was a study that was done by a guy by the name of Weiner, and he did a longitudinal study. A longitudinal study is years after years taking inventory and assessment of their subjects. And so in this case, it was children. It was a lot of children that was born in the year 1955 that had difficulties growing up, either they experienced some traumatic events in their lives. This took place on the island of Hawaii, in Hawaii. So these were all Hawaiian. And so they followed these children for several years. I think it's like 30 years or so. And what the authors found out that about 1/3 of those children who should have had, great impact them, these traumas should have impacted them negatively, they actually were competent, very self-confident, autonomous, and effective in their job. And so that kind of gave way to what made them so resilient. And what they discovered was really, really interesting. Is the choices that they had chosen, the course of their lives, their thought process, the feelings and behaviors that followed them that made the difference as well. So it's very interesting study to go see.
Now, you brought up something that I know we've talked about in previous podcasts was choices. You said the choices that those children made. So my question is, which is interesting that this idea of a person choosing something. So my question for you in terms of choice is, what are the health benefits of this resilience and this decision for these children to make a choice.
Right. So when you look at the research that surrounds resilience, there seems to be a negative correlation. That means the opposite happens, right, of individuals who are resilient towards psychiatric syndromes. Things like depression are on the opposite end, So the more resilient, the less likely they're to be depressed. The more resilient, the less likely they are to be anxious, or anxiety disorders are not there. Eating disorder are not there. Addiction also are not there. So these individuals, they do experience some short-lived distress, things like maybe a week or two or sleeplessness, but they're infrequent, things that do not unstabilize their health. And so they have that positive emotion. It's a positive emotion that they have that seems to overcome a lot of the even physical and mental, psychological things that could have happened to them as well.
Okay, so I know, because I'm thinking this, so I know our listeners are thinking, how do we get this resilience? So how is this resilience fostered in the wake of a trauma? Like, how is it possible?
And if you look at the literature as well, they talk about different types of trauma. They even type them. There's type 1, where it's a single event that took place that was traumatic. There's type 2, which is a chronic exposure to a specific trauma. It could be in the family as well. And there's type 3, which is a reoccurring multiple types of trauma that occurred from maybe from childhood until adulthood. All of those individuals, even still, they found that there is some resilience in them as well. Most people, they say, who are most people in their lifetime, in our lifetime in general, we will experience at least one type of trauma. That's unfortunate, but that's the world that we live in. But not everyone cope with the trauma in the same way. Some people experience acute distress. Some people, a longer time or shorter time. Some people, it impacts them not at all. It doesn't interrupt their function at work, their relationship, the challenges that they see with the trauma. They see ways to overcome it by looking at the trauma and see which way they can turn their life as a result of it as well. So interestingly, research coined this term sense of coherence, a sense of coherence. So these individuals have the ability, the quality of logically and consistently look at things and try to understand and try to manage, or trying to give meaning to those things. And so their perception of how the world works, they look at things like, this is a sinful world. They look at things like, fairness really does not exist here, and they accept it, and they're able to adapt their lives in such a way that say, okay, well, this didn't work, but maybe this one might work. Or they see ways to cope based on problem-solving skills as well. So this tend to improve their physical, psychological, even in the wake of trauma. And it doesn't matter what kind of trauma that they go through as well.
It sounds like this is still going back to choices that a person is making. Is that right?
It has a lot to do with choices, but also the way that they view life. So their perception of it as well.
Okay. All right, great. So let's talk about resiliency and how it's developed. And the question is the nature of resiliency considered a personality trait, or is it a skill that is learned? Okay.
So the way that people appear to cope and react to day-to-day adversity markedly determine how they're actually going to be resilient towards even the bigger things. Interesting, right? So how an individual reacts to dealing with stress. Do they find the strength? Are they able to find positiveness or positivity in situations? All those things seem to play a role within it as well. But there was a meta-analysis study. Meta-analysis meaning they're taking a whole little different studies and they put it together trying to find a common denominator there. And they looked to see what are some of the factors that negatively impact a person's trauma. Like how is it that some of them are resilient and some of them are not? So the ones that are not tend to lack social support. They had a family background that was negative. They had prenatal influences. They had previous psychological history, and they even disassociate themselves with the trauma. Interesting, right? So these individuals tend to not do well with their trauma. But the resilient individuals, they seem to find meaning in life as a result of it. They tend to surround themselves with positive influences so that they can grow and learn from the negative and the positive experiences as well. And so all of those things seem to play a role in it. And in this study as well that look at the day-to-day activities of those individuals, their emotions seem to be more positive. So positive emotions are things like gratitude. They're more grateful. They find interest in things. They love more. They have joy, and they laugh. They're jokester at times. And they find joy in things that are around them. So to answer the question, is it environment? Is it genetic? It can be both. It can actually be both. However, we know that environment seems to play a much, stronger role at times because we still have that control to say, I'm going to make the choices to see meaning behind things and to be grateful, find things to be grateful, so you can still learn those attributes as well.
Okay. Now, I think you touched on a few of those points already, like surrounding yourself with, positive people. But the question is, how do we learn to be resilient?
That's a good question. So the main thing is to see how you do with minor adversities on a day-to-day basis. How do you logically look at things and be consistent in the way that you deal with things? So, for example, how do you do with, let's say a person step on your toes? How do you do with a child spilling milk, accidentally? Let's say, how do you do with not passing a test that you studied so hard for, or you thought you were going to be a doctor and, you're not, and you're not going to be anymore. So it's how do you bounce back from those things? So to a smaller degree, your reaction to these small trials would magnify themselves to a larger degree, okay? So it's those individuals who are patient, who are able to look at things and not give up on themselves and find solutions, action-oriented approaches. Those tend to be individuals who do very well, actually. They have patience, they tolerate others, and they have optimism on their side and faith as well on their side. This reminds me of a Bible text in Revelation 14, verse 12, that says, hear the patience of the saints. They go through great trials and tribulation, but yet they're still standing and have the faith and prayer that's on their side that give them that positive emotion that's needed.
Okay. Some good points. So how common, because you talked about the resilient people, which is, you were talking about it's a smaller percentage of people, but how common is it that you find people who are resilient to trauma?
Okay, as I mentioned, the earlier study was that 1/3 of those children actually not okay. But resilience is actually very common. I think a lot of research tend to focus on the acute and chronic side of trauma, so we don't hear a lot of times about the resilience. And this is actually one of the reasons why I don't believe that everyone needs counseling after trauma in particular, because they will be okay if they have that resilience that's on their side. That might sound strange for a psychologist like myself or a social worker like myself to say, but it's true. Epidemiology study estimated that majority of U.S. in particular will be exposed to at least one trauma in their life, but not everyone goes through these experiences of dealing with negative effects of trauma. Some do, and some actually don't, but it's because of resiliency. And the research is actually showing that sometimes counseling and psychiatric evaluation actually undermine one's ability to naturally be resilient. So be careful, because counseling is not necessarily for everyone who experienced trauma. In some cases, they found that treatment will be ineffective or even harmful. So, be mindful of that as well. So resilient is not as uncommon as we think. And individuals who are resilient, another terminology that I would like to use to say is that they're survivors. They are survivors, and because they're survivors, constantly being exposed and having to talk about their experiences, not necessarily something that they need to do. They need to look at ways to improve. They can talk about their story and help others with their story, but it's not having necessarily to deal with the story in a way that doesn't provide any end to or a positive goal of helping or improving their life.
Okay, Dr. Dana Philossaint, what you just said I think is shocking for even the listener, myself included. You're saying that not everybody needs counseling, and is it because of, like you were talking about, constantly bringing up the trauma over and over and over again? Is that why it's negative, or is that just one of the reasons why it's negative?
Well,
for a person who's resilient. Go ahead.
For a person who's resilient, they've already known that they've gone through trauma. They understand that the trauma that they've gone through was negative. So they're not undermining it. It's just that they have found meaning in it already. They're able to live life. They're able to have a family. They're able to relate to others. They're able to socialize with people. So they already have these skills that are very meaningful because of the trauma. So for those individuals, counseling is not necessarily. It's to help them, for those individuals who actually have not gone to that point of finding meaning, of finding that they're survivors. And there are individuals who need that. I'm not, undermining that it is. But for those who have that resilience on their side, and one of the things that I do as well, before I see anyone, is I want to see if they have a level of resilience that they don't need counseling. I don't want anybody to come to counseling because I'm a psychologist or because I'm a counselor that they need to talk to people. And so be mindful of that, too, for all of those who are listening that are in the mental health field, that not everyone needs counseling if they have that resilience on their side, if they're able to cope, if they find meaning in the things that they went through already. And that counseling aspect of trying to always going over the trauma is not helpful at all. It might actually bring them down. That's the reason why I will say that.
Dr. Dana Philossaint, that was a powerful point. And I know for the listener, for all of us, I mean, that's just powerful. I don't think I've never heard that before. So that's amazing that you say that. So I have a final question for you. And it is, what are the 5 ways to build up resiliency no matter what the trauma is?
Good question. So here's the 5 ways. So number 1, I would say evaluate your reaction to day-to-day unexpected troubles and events. So we all have those things that we didn't expect to happen, and they did happen. How do you react to that? What is this message that you're telling yourself? What are you telling yourself about yourself, about the situation, about life, those kinds of things? And then from that, you can learn problem-solving skills. And, in the book that I wrote, the Mental Health Solution, there's a chapter that I dedicated specifically for problem-solving skills. How do you deal with problems? How do you solve those issues that come across you? So that's one thing. Number 2 is try to surround yourself with more positive influences. I have a cousin that I would say, she said something one time that I actually love, and I've been saying it ever since. Whenever she's around negative people, she would tell them, please don't disturb my peace. To the point where don't allow people to disturb your peace. That's number 2. Number 3, I would say, is learn how to spot positivity or even hope in every situation. And eventually, the more you do that, it will become automatic. And then number 4 would be build a strong mind. And you can do that by memorizing positive sayings or memorizing positive Bible texts so that when you need those things, it comes to your remembrance. And it can help you to overcome this trauma at the time. And lastly, but definitely not the least, is to choose to believe a more favorable outcome. So in other words, have faith that it will turn out to be okay. And so as a bonus, I would say this. If you don't know what your level of resiliency is, I'm going to provide to our subscribers and to all those who are listening an assessment tool that you can actually look at what is your resilience level, and that way you can see your score for yourself.
I like that quote, Dr. Dana Philossaint. Don't allow people to disturb your peace. Mm-hmm. And then number 5, choose to believe a favorable outcome. I mean, those were all 5 of them were powerful. Dr. Dana Philossaint, this was absolutely insightful and helpful information. For our listeners, don't forget to visit mindcare.us for resources. Dr. Dana Philossaint talked about her book. That's definitely on the website as well. And also you can find additional information on the website as well. And don't forget to like and subscribe. See you on the next episode.